Good evening, my dear students. So now we can discuss the MCQ from so this is a MCQ of mental health nursing. So let us discuss one by one. Which of the following is a criterion for mental health? Which of the following is a criterion for mental health? Efficiency in work and place, disturbance in day-to-day activities, able to perform activities independently, personal insecurity. Efficiency in work and play, disturbance in day-to-day activity, able to perform activities independently, personal insecurity. The answer is efficiency in work and play. If the person has the capacity or the person has efficiency in work and play, so that is one of the criterion for mental health. The next second question, which of the following is an important characteristic of mentally healthy person? Which of the following is an important characteristics of mentally healthy person? Able to perform activities independently, able to make adjustment, feel secure, changes in the behavior. Changes in the behavior, it is not a characteristics of mental healthy person. Feeling secure is not a characteristics of mental healthy person. So this one, the answer is ability to make adjustment. The mentally healthy person, he can make adjustment in any situation, and this one able to perform activities independently. So this is not a particular characteristics of mental healthy person. The particular characteristics of mental healthy person is this one, able to make adjustment in any environment. Then next question, third question, chlorpromazine drug was introduced in. Chlorpromazine drug was introduced in 1942, 1952, 1962, 1972. The answer is 1952. Chlorpromazine was a drug introduced in the year 1952. Chlorpromazine drug was introduced in the year 1942, 1952, 1962, 1972. The answer is 1952. Then next, who wrote the book The Mind That Found Itself? Who wrote the book The Mind That Found Itself? Clifford Beers, Linda Richards, Maxwell Jones, Philip Finner. Who wrote the book Mind That Found Itself? The answer is Clifford Beers wrote the book The Mind Found Itself. Then next question, who is the first psychiatric nurse? Who is the first psychiatric nurse? Helga Pepler, Betty Newman, Linda Richards, Florence Nightingale. The answer is Linda Richards. The next one, next question, who introduced therapeutic community? Who introduced therapeutic community? Maxwell Jones, Philip Finnan, Benjamin Rush, Bloor. The answer is Maxwell Jones. The next question, the Indian Nursing Council included psychiatric nursing as a compulsory course in BSc nursing program during. The Indian Nursing Council included psychiatric nursing as a compulsory course in BSc nursing program during 1945, 1947, 1952, 1965. The answer is 1965. The next question, The Indian Nursing Council included psychiatric nursing subject as a component of general nursing and midwifery course during. The Indian Nursing Council included psychiatric nursing subject as a component of general nursing and midwifery. But when the INC added this psychiatric nursing in GNM course in 1956, 1965, 1974, 1986. The answer is 1986. The next question. The Indian Society of Psychiatric Nurses was formed in the year. The Indian Society of Psychiatric Nurses formed in 1986, 1989. On 1991, 1995. The answer is 1991. Then, next question. Lithium was first introduced for the treatment of mania in. Lithium was first introduced for the treatment of mania in 1938, 1949, 1952, 1955. The answer is 1949. Then ECT was first used for the treatment of psychosis in 1938, 1949, 1952, 1955. The answer is 1938. Then a post-certificate course in psychiatric nursing was introduced at the NIMHANS, Bangalore in 1938, 1949, 1952, 1956. The answer is 1956. Then the Indian Mental Health Act was passed in the year. The Indian Mental Health was passed in the year 1912, 1952, 1980, 1987. The answer is 1987. The next question. The following are the approaches of National Mental Health Program except integration of mental health care service in existing general health services. It is the component of National Mental Health Program. This one, eradication of stigma regarding mental health illness. It is not a component or approach of National Mental Health Program. The next, utilization of existing infrastructure in health services to deliver mental health care services. It is also component of National Mental Health Program. Okay. The next question. Government of India launched the National Mental Health Program in the year 1982, 1989, 1995, 2000. The answer is 1982. The next one. The following professionals are a part of a multidisciplinary team except. The following professionals are a part of multidisciplinary team except psychiatric nurse, clinical psychologist, psychiatric social worker, nurse manager. The following professionals are a part of multidisciplinary team except psychiatric nurse, clinical psychologist, psychiatric social worker. Okay, nurse manager is not a team member in the multidisciplinary team. Okay, the next, the nurse manager act as an advocate for patient, therapist for family members, educator for family members, specialist for patient. The nurse manager act as an answer is advocate for patient. The next one, factors influencing level of nursing practices. Factors influencing level of nursing practices. Nurse Practice Act, nurse qualification, professional practice standards, all the above. The answer is all the above. Influencing. So these are the factors influence the level of nursing practice. Nurse practicing at qualification, professional practice. Without proper qualification, the nurse can't do the work, and not only that, without proper practice, the nurse can't do any work in any hospital. So these are all the factors affecting the nurse practice. The next one, medical model considers the cause of mental disorder as a result of. Medical model considers the cause of mental disorder as a result of organic pathology in the brain, use of maladaptive behavior, strict societal norms, abnormal cultural practices. The answer is organic pathology in the brain. Then, behavioral model considered the cause of mental disorders a result of. Behavioral model considered the cause of mental disorder as a result of organic pathology in the brain, use of maladaptive behavior, then strict societal norms, abnormal cultural practices. The answer is use of maladaptive behavior. So this is the one of the cause for the mental disorders. Behavioral model, according to behavioral model, changes in the behavior, so that we can call the maladaptive behavior is one of the cause for mental disorder. Then next one, the main aim of National Mental Health Program is. The main aim of National Mental Health Program is prevention and treatment of mental illness. So this is the main aim of National Mental Health Program. Curing of mental illness, eradication also, these are not okay, these options are not aim of national mental health program. So prevention and treatment of mental illness is the aim of national mental health program. The next question, the term schizophrenia was coined by, the term schizophrenia is coined by Philip Pinel, William Took, Eugen Bleuer, Benjamin Rush. The answer is Eugen Bleuer coined the term schizophrenia. Okay, so these are all the MCQ of mental health. So in the next class we can see MCQ from different topic. Thank you.